Okay, Dr. Filner, we are live on Facebook. Hey, hey. Welcome everybody. My name is Kim Shepard. I have Dr. Bernard Filner on today. He is the Chief Medical Officer at Microlight Laser. He's been teaching about microlight infrared 830 nanometer laser for a long time, but he's been a physician. He's still a physician. He used to help people with pain relief until he discovered the 830 nanometer laser and started using that in his practice and got such good results that he decided to get behind this and support the education. And so that's why he's showing up today. I'm showing up today because I had a huge transformation. I had 11 pins in a plate in my ankle, and 9 years I suffered with limping and swollenness and edema, and you name it, it was a problem. And it was just the way my life, I decided, was probably going to be for the rest of my life. It probably got getting worse. Wondered if I was even going to have a cane at one time. And in about 4 years ago, someone introduced me to this laser, and it changed my life. Two treatments, a total of 20 minutes. My condition that I've suffered for 9 years was completely gone. I don't even remember now that I had an injury, unless I sit on my ankle, which I try not to do. But that's just one of many stories, Dr. Filner. And I know you've seen many, many examples of complete transformations. And today we're going to talk about one because I know it's kind of a hot subject, and it's migraine headaches. I know we talked about this often, but it is really something that is terrible to have to go through. And I brought my laser here too, so I'm going to show you what Dr. Filner says as far as using this laser and treating a migraine, and the evidence and supporting the great results from using the infrared laser. And so Dr. Filner is going to kind of discuss, number one, what is it, what triggers it. But I know when I had a jaw realignment surgery, it triggered migraine headaches every day, all day for 4 months. And I had to live on ibuprofen, very strong ibuprofen prescription, which you know is bad for your liver. So then I have a liver issue. And so that never really seems to go away. So it's this bad cycle. And so if you could find, this is before I ever knew anything about the laser. And so had I known, things would be a lot different with my poor liver. But so for now, Dr. Filner, let's talk about migraine headaches again, because this is such a big subject and so many suffer. And it's when I never had a migraine headache before that jaw alignment. And now I understand how bad it is, because I remember somebody was just trying to get ice out of a cup with their fingers, and it was like someone was smashing my brain against rocks. And I remember thinking, I don't know how people that have been told that there is no solution for your migraines. So I'm going to turn it over to you, Dr. Filner, because you know that there is a solution for migraine headaches now.
Right. That the migraines I think, are probably a bit overdiagnosed by neurologists in this country. But what you can do in my practice, what I learned was that in order to say that someone definitely had migraines, you wanted to have a headache on one side with an aura, meaning either some sort of a sensory order, visual or taste, or hearing, some type of an aura that then signals the onset of the headache. Then you know you have migraines. But there are a lot of other situations where it can be a migraines, but then you have to sort of sort out the symptoms and try to get a handle on what the problem is. I mean, neurologists have started to call abdominal migraines and, chest migraines, all sorts of other things. So I think it's really important to establish the diagnosis first. And in my practice and talking to neurologists who understood the problem, migraines seem to always start with neck pain. Patient starts to have some neck pain. That's not always true, but mostly true. And there are trigger points in these muscles that are tight, and they're starting to cause a headache. And this, in susceptible individuals, then transitions to a migraine. And what's important to understand is a lot of the pharmaceuticals that are, if you watch any television at all, you're seeing ads for migraine medications like every hour or two, practically. And they all talk about you have to read the fine print on these advertisements, and it's hard to do that sometimes because they seem to go away so fast. But for instance, when Botox is advertised for headaches, they talk about it's approved for headaches 15 times that are happening 15 times a month, and you expect to reduce that to 14 times a month if it's successful. And a lot of these medications don't mention the fact that they may take weeks or months to be fully effective. And a lot of them are just there to reduce the number of headaches that one has, which migraineurs are often happy for if they get away from daily migraines into once every few days. However, once I had discovered how to treat a migraine with the laser, it's totally different than with the pharmaceuticals. That with the technique that I developed with the laser, it takes 6 minutes, 3 minutes on each side to get rid of the headache, and the headache goes away, assuming that the practitioner has had enough practice to be able to do it fastly. And it works every time, unless you've been away from it for a long time, in terms of the practitioner not using the technique. Let me explain a little bit about how it works. First of all, when you're using Botox, the injections that work are done here in the glabellar region. And the reason that they do work when they do is the drug diffuses down into the area of the sphenopalatine ganglion. And Botox only works where acetylcholine is the transmitter between nerves and the ganglia. Okay, so that's established that's where control of migraines is important. In terms of what the anatomy is like, most people think that the nasal passages go up, but they don't. They actually go straight back. And underneath the lining of the nasal passage is something called an ethmoid plate, which is a fibrocartilage area that has holes in it that allows for movement of substances. And just below that ethmoid plate is the sphenopalatine ganglion, which has both sympathetic and parasympathetic fibers and cell bodies. And acetylcholine is a transmitter there, which is why Botox can work sometimes. Not all the time, but it does work sometimes. I went to a lecture by a dentist who described a technique where he was taking a 3.5-inch needle and placing it here, aiming it towards the sphenopalatine ganglion, which lies right underneath the nasal mucosa here. And he was getting reasonable results in stopping a migraine. Every patient that he treated got a black eye because there are a lot of blood vessels there. And he was penetrating those blood vessels with a large needle. He was using a 25 gauge, 3.5-inch needle, which was probably very unpleasant for the patients receiving that treatment. And I asked him whether or not the laser would work. And he said he didn't know, he'd never tried it. So I went back to my practice. And after about a week of attempting to reproduce the response, I was able to uh, demonstrate that it worked on patients with a migraine. Over the course of about the last 3 years of my practice, I saw a total of 12 patients that were either the teenage children of my patients or my patients I was seeing for something else, who had migraines that were unresponsive to every medication and every attempt to stop the headache. So I had these 12 patients who basically were at the end of their rope in terms of trying to find some sort of relief. And in each of these patients, I examined, the first thing I did was examine their neck to make sure that they weren't having trigger point induced pain and headaches. And then I did use the technique that I had developed to aim the laser at the sphenopalatine ganglion. And when I did that over the average visits, the age group was, I guess, about 16 through late 50s in terms of the patients. And the average treatment schedule was about 8 sessions. And all 12 are now headache free completely. And that's a very unusual and very highly significant case report. And basically, the idea is to take the individual single beam and place it right over the zygomatic arch, which is this bone that you feel here, not up where the eye is, but just below that. You'll feel a bone that comes like in a slightly circular way, and you put it right there.
Is it the
and
right
aim
spot
it
right there?
roughly. That's the case, and you aim it slightly down and slightly not so far and slightly forward to aim for the sphenopalatine
Oh, I
ganglion.
see. Forward.
There's
Okay.
actually the company has put on YouTube has put a video that shows me demonstrating that technique.
Okay. I'll put it up because I have it in our training. So that's great.
Right, and
Mhm.
it takes practice for the practitioner to get that, or for the patient to get that and work. But over a course of, in my case, it took me about 4 or 5 days of trying it every day till I got it to work completely. And while I was doing them frequently, it always worked. It would never fail to relieve the headache. And it was essentially, it took 6 minutes with no side effect and no pain associated with it. And my experience with the laser helped in terms of dealing that. Ever since I learned about the laser in 2004, it took about a year till I stopped doing injections into trigger points. And I since have inactivated about 400,000 trigger points with the laser. And basically, since earlier than that, I had done about 600,000 trigger point injections. And I had been an anesthesiologist for 19 years and done nerve blocks. I got to be very skilled with aiming these, especially the single beam, and prior to that, doing trigger point injections. A lot of patients that I got referred from around the country were actually sent to me just to do trigger point injections, because it's a skill that takes a lot of effort for people who haven't done other things like nerve blocks that I had done, to learn how to do that.
So prior to the laser, Dr. Filner, when you treated a migraine, prior to learning about the laser, how did you typically treat it before?
The only way I was able to treat it prior to that was tried to using the laser, was to find trigger points in the neck and hope that that resolved the headache.
Right.
And probably maybe 20% of the time, the diagnosis was not accurate, and it was, in fact, headaches coming from the neck muscles. So that I was able to treat those patients, but I wasn't getting very many referrals for migraine treatment until I started to do this treatment. And some of the neurologists in our area heard about it and started referring some of the patients to me. So I got a chance to see more of those patients than I would have otherwise. We had a patient, a young woman in Sweden, who had had migraines since she was, I think, 10, and they were recurring every day. And she heard about the laser and saw the video that was posted on YouTube, and she was able to get about a 60+% response that lasted for a number of months, and then they came back. So she called the company, and we got on a Zoom with her, and I adjusted how she treated her migraines. And within 2 days, she was pain-free again, and they haven't come back. And another really dramatic thing that might be related to some of what you were describing in your situation was there's a group of migraineurs that's formed a society, and they have a meeting maybe once a year. And not this year because I was sick and wasn't able to travel, but the year before, actually it was just this past year before I got sick. We went to Minneapolis, and I saw a patient there who was in her 20s, early 20s, who since she was 6 years old had not been able to open her mouth more than an inch without it setting off a migraine. And she basically had existed on liquid diet or a pulverized diet, so that she was able to basically eat with a straw most of her life since she had been 6 years old.
Wow.
And she was in her early 20s. And I treated a number of trigger points in her masseter muscles on both sides and a couple in her upper neck in the front. And she was able to open, within 5 minutes, she was able to open her jaw completely. And she started crying.
Oh,
She hadn't been able to do that for almost 20 years.
oh my goodness.
And had been having migraines every time she tried. So it's
That's
sort of interesting
unbelievable. That's a
situation.
complete transformation, Dr. Filner. That's more than a life change. That's just generationally. Can you imagine if she had to go through her life like that? The children have to see that. I mean, the impact that this laser has on people is profound. I know
At,
we're seeing, yeah, go ahead. I know you see so
yeah,
much.
at that meeting, I treated almost, I guess, 80% of the attendees, and every one of them had relief of their headache.
Wow.
So, I mean, it's certainly remarkably different than trying these medications. I mean, one of the medications says it works in 20 minutes, but it turns out, or excuse me, it works in 20 hours or 2 hours. It turns out that only 20% of the cases get better in 2 hours, and only 40% get better at 4 hours. And you really have to look at the fine print of these things. Some of them may take months to get a significant improvement in the numbers of headaches that people are taking. And once a practitioner has learned the technique or a patient has learned the technique, it's, in my experience, it's often a few months of treatment without any side effects or pain from the treatment, and the problem is gone.
Well, I think that's what I love about this because Dr. Filner, your history isn't it didn't you've come through this of learning and seeing and the complete transformation of one or two or three treatments, or seeing that patient 8 times and getting them completely free of the migraines. And that doesn't come, the pharmaceutical doesn't come without side effects.
Right.
And uh, and so if you have an option to either acquire a laser for yourself or find someone that is using this in your area, I would highly suggest trying this before going into, like Dr. Filner talks about, pain pills, where that was the protocol, right? Just prescribe pain meds, right?
That's right. And it may take weeks to months, if not longer, to have significant changes in the pattern of migraines that a patient has. Plus, you get into problems if they started on opiates, which don't really work very well for this. You run into problems with medication overuse, and it's a major problem for a lot of the neurologists. They have to be very careful with all the medicines that they prescribe. Uh, Plus, I think that it's what's key is that a lot of these medications that they talk about and advertise so heavily may not work to get rid of the migraines. They only decrease the number that you have.
Yeah. And I know there's a lot of people right now that might be looking for a solution. I know if someone had told me this when I was going through my pain, I would have been like, I'll try anything. And I know there's many people, maybe this is the first time you've heard about the laser, or maybe you know someone that's suffering from migraine headaches, or just that the symptom of another problem might be a neck issue or a trigger point around that area. You could try the laser, and I think you're going to get great results. And so it can take you down a road to maybe complete recovery, right, Dr. Filner?
Yeah, and one of the things I would recommend is that even just in the beginning, if you uh, get on the website, the company's website at microlightcorp.com, if you put in your zip code, you can get on a form on the website. It will tell you who has the laser in that area. So if you're looking for a physician, chiropractor, a PT that has a laser that you might want to get to try it, you can do that through the company's website in terms of finding out who has a laser in your zip code. The other thing that the company is very liberal in terms of uh, the if you decide that you want to purchase the laser, they'll often give you a 2 to 4 week trial where you can they will actually send it to you and let you use it for a few weeks. And if it works, fine, you purchase it. If it doesn't work or you're not, comfortable with it, you can just send it back without any cost. And the company is very willing to do that. Plus, I might also add that I'm almost as busy as I was with my practice, uh, except for the last 6 months when I was sick, of doing Zooms 2 or 3 times a week and phone calls. So that if you do get a laser and you have questions about it, or you want to learn something, we can the company will get on a Zoom with me, and I can give you hints about how to use it properly and get the best results. I think I've probably had more experience in using it than just about anybody. I've inactivated about over 400,000 trigger points with it myself. Plus, I've been, consulting and training people all over the world, basically in Europe, South America, and around the United States.
Yes, you have been side by side, teaching and educating Dr. Filner. I mean, you completely changed your practice into a non-invasive treatment for a lot of conditions, and where a lot of the other medical doctors were using their prescription pad. So I want to thank you for, first of all, being open-minded to even take a look at another therapy. And then two, selflessly showing up and helping people understand there is a solution, or maybe a better solution to the road they're going down. Maybe it's a road that they feel hopeless, like I did. And so we are giving hope. You are giving hope by showing up and showing people that you can treat this, and then the resource into finding someone who actually either has a laser, or if you want to acquire one yourself and get yourself certified, you would be able to treat individuals as well with the
Yeah,
laser.
one of the things that some people ought to remember, that if they are seeing a practitioner for other problems or for a chronic pain problem, and they ask that practitioner about the laser, if the practitioner says, "Oh, it's useless, don't use it," no, it can't possibly work. The next question ought to be, "Have you ever used it?" Because most practitioners who will take that approach and say it's useless, it can't work, they've never used it and don't know how it works. And so it's important to really ask them what their experience has that they're basing that opinion on. And I think most of the time when I have run into that and I've asked a practitioner what they think, and if it's all negative, I'll ask them if they've ever used it, and they often say, "I don't know anything about it." And then I'll tell them, "Why do you express an opinion?"
Thank you. Thank you, Dr. Filner. You've been amazing today. Tune in next week, next Thursday. Dr. Filner will be back live. We'll have another subject of concern for the human condition. We're here to shine light on devices and natural wellness, all the way from skincare with chiral technology to CBD to hemp and to infrared lasers. And we're huge believers of it. It works. We've seen it. We proved it. We have seen it with our own eyes. And I am my own testimony on this one. So tune in next Thursday at 2 p.m. We will be here waiting for you guys, and share this Facebook group with other people, because we really try to offer a lot of free advice, and just support as we move through this journey of people trying to get back to nature. We want to be that pathway to show and draw people back to nature the way it should be. That's where we came from, and let's get back there. We love you, Dr. Filner. Again, thank you so much for your support and
Oh,
all the
you're
time you
more than
spent.
welcome. I'm happy to do it.
Well, you're amazing. And I don't know anybody that knows any more about this laser than Dr. Filner. So it's a gift that just keeps giving. So we'll see you next week, Dr. Filner. You have an amazing
Okay.
weekend. Bye, everybody.
Bye bye.